Living with diabetes doesn't mean life stops, it just means it changes. And with the right treatment and lifestyle choices, you can take full control of your health. In today's video, we're breaking down the most effective treatment options for diabetes. From medications and insulin to powerful lifestyle changes that really work. Whether you're newly diagnosed or just looking for better ways to manage your blood sugar, this video is for you. We'll also share practical tips that make managing diabetes easier, safer, and less stressful, including what to eat, how to stay active, and the small daily habits that make a big difference. So if you're ready to feel more confident and in control of your diabetes journey, stick around. Let's dive in. But here's the good news. Most of these complications can be prevented or delayed with proper care and effective treatment. So now, what are the treatment options for diabetes? Actually, treatment depends on the type of diabetes. Let's begin with treatments for all types of diabetes. An important part of managing diabetes, as well as your overall health, is keeping a healthy weight through a healthy diet and exercise plan. Healthy eating. Your diabetes diet is simply a healthy eating plan that will help you control your blood sugar. You'll need to focus your diet on more fruits, vegetables, lean proteins, and whole grains. These are foods that are high in nutrition and fiber and low in fat and calories. You'll also cut down on saturated fats, refined carbohydrates, and sweets. In fact, it's the best eating plan for the entire family. Sugary foods are okay once in a while. They must be counted as part of your meal plan. Understanding what and how much to eat can be a challenge. A registered dietitian can help you create a meal plan that fits your health goals, food preferences, and lifestyle. This will likely include carbohydrate counting, especially if you have type 1 diabetes or use insulin as part of your treatment. The second important thing is physical activity. Everyone needs regular aerobic activity. This includes people who have diabetes. Physical activity lowers your blood sugar level by moving sugar into your cells, where it's used for energy. Physical activity also makes your body more sensitive to insulin. That means your body needs less insulin to transport sugar to your cells. Get your providers okay to exercise. Then choose activities you enjoy, such as walking, swimming, or biking. What's most important is making physical activity part of your daily routine. Aim for at least 30 minutes or more of moderate physical activity most days of the week, or at least 150 minutes of moderate physical activity a week. Bouts of activity can be a few minutes during the day. If you haven't been active for a while, start slowly and build up slowly. Also, avoid sitting for too long. Try to get up and move if you've been sitting for more than 30 minutes. Now let's move to treatments for type 1 and type 2 diabetes. Treatment for type 1 diabetes must start with insulin, either as insulin injections or the use of an insulin pump, because pancreas cannot produce insulin, so oral drugs cannot be used. For type 1 also, you need frequent blood sugar checks and carbohydrate counting. For some people with type 1 diabetes, pancreas transplant may be an option. Treatment of type 2 diabetes mostly involves lifestyle changes, monitoring of your blood sugar, along with oral diabetes drugs, because in type 2, your body still produces insulin, but the problem is that your cells don't not respond to it. But if these drugs cannot control the case, or the patient will undergo a surgery, then we have to use insulin. Let's talk a bit about insulin. People with type 1 diabetes must use insulin to manage blood sugar to survive, as we have mentioned, and many people with type 2 diabetes or gestational diabetes also need insulin therapy. Many types of insulin are available, including short-acting, rapid-acting insulin, long-acting insulin, and intermediate options. Depending on your needs, your provider may prescribe a mixture of insulin types to use during the day and night. Insulin can't be taken orally to lower blood sugar because stomach enzymes interfere with insulin's action. Insulin is often injected using a fine needle and syringe or an insulin pen, a device that looks like a large ink pen. An insulin pump also may be an option. Sometimes your provider may prescribe other oral or injected drugs as well. Some diabetes drugs help your pancreas to release more insulin. Others prevent the production and release of glucose from your liver, which means you need less insulin to move sugar into your cells. Still others block the action of stomach or intestinal enzymes that break down carbohydrates, slowing their absorption or make your tissues more sensitive to insulin. Metformin is generally the first drug prescribed for type 2 diabetes. There is another line of treatment, which is transplantation. In some people who have type 1 diabetes, a pancreas transplant may be an option. With a successful pancreas transplant, you would no longer need insulin therapy. But transplants aren't always successful, and these procedures pose serious risks. You need a lifetime of immune-suppressing drugs to prevent organ rejection. These drugs can have serious side effects. Because of this, transplants are usually reserved for people whose diabetes can't be controlled or those who also need a kidney transplant. Some people with type 2 diabetes who are obese and have a body mass index higher than 35 may be helped by some types of bariatric surgery. People who've had gastric bypass have seen major improvements in their blood sugar levels. But this procedure's long-term risks and benefits for type 2 diabetes aren't yet known. Now, treatment for gestational diabetes. Controlling your blood sugar level is essential to keeping your baby healthy. It can also keep you from having complications during delivery. In addition to having a healthy diet and exercising regularly, your treatment plan for gestational diabetes may include monitoring your blood sugar. In some cases, you may also use insulin or oral drugs. Your provider will monitor your blood sugar level during labor. If your blood sugar rises, your baby may release high levels of insulin. This can lead to low blood sugar right after birth. And here is a surprise: there is a treatment for prediabetes too. Treatment for prediabetes usually involves healthy lifestyle choices by healthy diet and exercise. These habits can help bring your blood sugar level back to normal, or it could keep it from rising toward the level seen in type 2 diabetes. Keeping a healthy weight through exercise and healthy eating can help. Exercising at least 150 minutes a week and losing about 7% of your body weight may prevent or delay type 2 diabetes. Drugs, such as metformin, statins, may be an option for some people with prediabetes and other conditions, such as heart disease. Managing diabetes is a lifelong journey. Here's what follow-up usually includes. Visit your doctor every 3 to 6 months. Get regular eye exams, foot exams, and kidney function tests. Keep track of your HbA1c, cholesterol, and blood pressure. Adjust your treatment plan as needed. Regular check-ins help catch problems early and keep your health on track. Here's what you can do to stay healthy and manage diabetes well. Diabetes is a serious disease. Following your diabetes treatment plan takes round-the-clock commitment, but your efforts are worthwhile. Careful diabetes care can reduce your risk of serious, even life-threatening, complications. Here are 10 ways to take an active role in your diabetes care and enjoy a healthier future. 1. Make a commitment to managing your diabetes. Members of your diabetes care team, primary care provider, diabetes care and education specialist, and dietitian, for example, can help you learn the basics of diabetes care and offer support along the way. But it's up to you to manage your condition. Learn all you can about diabetes. Make healthy eating and physical activity part of your daily routine. Maintain a healthy weight. Monitor your blood sugar and follow your healthcare provider's instructions for managing your blood sugar level. Take your medications as directed by your healthcare provider. Ask your diabetes treatment team for help when you need it. Avoid smoking or quit smoking if you smoke. Smoking increases your risk of type 2 diabetes and the risk of various diabetes complications, including reduced blood flow in the legs and feet, which can lead to infections. Smoking can cause non-healing ulcers and possible amputation due to reduced blood flow. It also leads to worse blood sugar control, increasing diabetes complications. Smoking increases the risk of heart disease and stroke in people with diabetes. It also can cause eye disease, potentially leading to blindness, as well as nerve and kidney damage. Smoking can lead to premature death in individuals with diabetes. It's crucial to talk to your healthcare provider about ways to help you stop smoking or using other types of tobacco. Keep your blood pressure and cholesterol under control. High blood pressure can damage your blood vessels, just like diabetes. High cholesterol makes the damage worse and more rapid. When high blood pressure and high cholesterol team up with diabetes, they can lead to a heart attack, stroke, or other life-threatening conditions. Managing these is essential. Adopting a healthy, reduced-fat, low-salt diet, avoiding excess alcohol, and regular exercise can significantly help control high blood pressure and cholesterol, essential for diabetes management. In addition to lifestyle changes, your healthcare provider may recommend taking prescription medication if necessary to help manage high blood pressure and cholesterol levels effectively. Schedule 2 to 4 diabetes checkups a year, along with yearly physicals and routine eye exams to monitor your health and detect any complications early. During a physical, your healthcare provider will ask about your nutrition and activity level and check for diabetes-related complications like kidney damage, nerve damage, and heart disease. Your healthcare provider will examine your feet for any issues that may need treatment. Regular foot exams are vital in diabetes management to prevent severe complications such as infections or ulcers. Your eye care specialist will check for signs of retinal damage, cataracts, and glaucoma, which are common diabetes-related eye conditions that can affect vision. Early detection through routine eye exams helps prevent vision loss. Keep your vaccines up to date. Diabetes increases your risk of getting certain illnesses, but routine vaccines can help prevent them. Talk to your healthcare provider about which vaccines are right for you. Yearly flu vaccine helps you stay healthy during flu season and prevents serious flu-related complications, which is especially important for individuals with diabetes. The pneumonia vaccine is important for individuals with diabetes. Sometimes it requires only one shot, but those with diabetes complications or aged 65 or older may need a booster. The hepatitis B vaccine is recommended for adults with diabetes who haven't previously received it and are younger than 60. Those 60 or older should consult their healthcare provider about getting the vaccine. Stay up to date with your tetanus shot, typically every 10 years, to prevent serious infections. Your doctor may also recommend other essential vaccines based on your health needs. Take care of your teeth, as diabetes may make you prone to gum infections. Brush your teeth at least twice a day with fluoride toothpaste and floss once daily. Maintaining good oral hygiene helps prevent gum disease and other dental issues related to diabetes. Schedule dental exams at least twice a year. Call your dentist if your gums bleed or look red or swollen. Regular dental checkups help in detecting and treating potential gum infections early, maintaining overall oral health. Pay attention to your feet. High blood sugar can reduce blood flow and damage the nerves in your feet. Left untreated, cuts and blisters can lead to serious infections. Diabetes can lead to pain, tingling, or loss of sensation in your feet. To prevent foot problems, wash your feet daily in lukewarm water. Avoid soaking your feet, as this can lead to dry skin. Dry your feet gently, especially between the toes. Moisturize your feet and ankles with lotion or petroleum jelly. Do not put oils or creams between your toes. The extra moisture can lead to infection. Check your feet daily for calluses, blisters, sores, redness, or swelling. Consult your doctor if you have a sore or other foot problem that doesn't start to heal within a few days. If you have a foot ulcer, an open sore, see your doctor right away. Don't go barefoot, indoors or outdoors. If you have diabetes and other cardiovascular risk factors, such as smoking or high blood pressure, your doctor may recommend taking a low dose of aspirin every day to help reduce your risk of heart attack and stroke. If you don't have additional cardiovascular risk factors, the risk of bleeding from aspirin use may outweigh any of its benefits. Ask your doctor whether daily aspirin therapy is appropriate for you, including which strength of aspirin would be best. Alcohol can cause high or low blood sugar depending on how much you drink and whether you eat at the same time. If you choose to drink, do so only in moderation, which means no more than 1 drink a day for women and 2 drinks a day for men. Always drink with a meal or snack, and remember to include the calories from any alcohol you drink in your daily calorie count. Also, be aware that alcohol can lead to low blood sugar later, especially for people who use insulin. If you're stressed, it's easy to neglect your usual diabetes care routine. To manage your stress, set limits, prioritize your tasks, learn relaxation techniques, get plenty of sleep, and above all, stay positive. Diabetes care is within your control. If you're willing to do your part, diabetes won't stand in the way of an active, healthy life. So now you know, diabetes isn't just about sugar. It's about how your body handles energy. It's about insulin, lifestyle, and yes, choices. But here's the truth. Whether you're living with diabetes, trying to prevent it, or just supporting a loved one, knowledge is power. You can live a full, healthy life with diabetes. You can prevent serious complications. And most importantly, you're not alone. Millions of people are managing it every day with small steps. A healthier meal, a short walk, regular checkups, and staying informed. If this video helped you understand diabetes better, don't keep it to yourself. Share it with someone you care about. Let's beat the myths, spread the facts, and take control together. And remember, it's not about being perfect. It's about being aware and taking action one day at a time. Stay healthy, stay curious, and we'll see you in the next video. So now you know, diabetes isn't just about high blood sugar. It can cause sudden problems like low sugar, hypoglycemia, or dangerous conditions like diabetic ketoacidosis. And if it's not well controlled over time, it can slowly harm your eyes, kidneys, nerves, heart, and more. But here's the good news. Most of these complications can be delayed or even prevented with the right care, regular checkups, and smart lifestyle choices. So take control, not just of your sugar, but of your health. Your future self will thank you. If you found this helpful, give it a like, and don't forget to subscribe, because in the next video, we'll show you simple steps to protect your body from these complications. See you there.